Well, let's talk about the big deal about retatrutide first. Why it's so big. So you mentioned about weight loss. So I'm going to give you some numbers here that might make your jaw drop. The thing here is with retatrutide. So when you're talking about 4 months of usage here, 24% weight loss has been produced. And then patients are still losing weight even after month six, month five, or month six. They're still losing weight. Because when you get to that point with semaglutide and tirzepatide, that weight loss is probably going to be plateauing. So when you compare the percent of weight loss, 15 to 20% is what the semaglutide and tirzepatide is their limit for, as you heard of Retta, 24%. So that's one. And this is really the first time a medication made obesity researchers ask if the scale was broken. And then second would be resting metabolic rate. Unlike GLP-1 meds, it really relies more of eating less. So that's why the nausea. But Retta increases your energy expenditure to 40 to 50% of the total calorie deficit compared to the other two, 15 to 20%, which is mild to moderate. And then, as I think we had this conversation before we started to talk, massive liver fat reduction for fatty livers. Here's a number: 82% reduction in liver fat. It's unheard of.
It is.
Right. Comparing it to the two, 30 to 45%. It's almost like half. And this is significantly improves insulin sensitivity and does not even worsen the fibrosis markers or the damage on the liver on testing. And going back to your question, why does our like bodybuilders like Retta? So better fat to muscle loss ratio. So this was actually tested on DEXA scans. Only 25 to 30% lean mass loss. So it's not zero. So this is still an issue if you think about it. But comparing it to the older two, which actually has a 35 to 40% loss for lean mass. So again, this is lower. It's not really totally removed from the conversation for the GLP ones, but this one is a triple agonist. It's still going to be there, but it's the lowest one out of all three.
So let me just put that in perspective for everyone out there listening. What you just said, Doc, 24% weight loss. That means if you're a man and in 4 months, you go from 200 pounds to about 150. Are you kidding me?
Yep, that's true.
Without losing much lean tissue is what the research is showing. 200 to 150.
Yeah. I mean,
My,
surgery, I think, is your next comparison for that bariatric surgery, but this one is the real deal.
normally, if you did that, you'd be seriously skinny fat.
Yeah,
I mean,
true.
you would look goofy going from 200 to 150 because normally half of that would be lean tissue. I mean, I'm no doctor, I'm no expert, I'm no scientist, but I've been looking at this stuff and doing this for 50 years. I've been a gym rat.
Right.
So I just want everybody to realize that puts what you just said in perspective. That is about 50 pounds lost in that time frame. If you weighed 200 pounds, what if you weighed 300? Do the math. So this could be one of the biggest medical breakthroughs in a long time.
It actually is, Steve. And